Hello there, you're welcome to our Health Hour, your go-to podcast for informative discussions around women's health. In the gym, your car, kitchen, or wherever you decide, tune in every 2 weeks for new hot topics you don't want to miss. And hold on, do not forget to follow us on all our social media platforms so you join the conversations at our Health Hour.
Hello, everyone. Welcome to another episode of Her Health Hour. My name is Hikmat, as always, and with me in the studio is
Balikis Abubakar. You're welcome to another episode of our Health Hour. And I'm very excited about this particular episode because we'll be talking about a stage where many women feel it's both exciting and overwhelming. It's the second trimester, the third trimester, and of course, we'll be touching on delivery as well. So grab your tea and get ready to learn everything you need to know about this last phase of pregnancy and also, of course, preparing for delivery. So, Hikma, how do you want to start this?
so we've been through like this pregnancy series together. We've done before the bomb. We you should go and actually listen to. We've done the first trimester, and today we're doing the second and third trimester, and also the fourth trimester, which is after delivery. And most importantly, advocating for yourself as a woman in our society today. So I'm really excited, and let's get started.
I think this particular episode, we want people to feel like you are sitting with your friends, talking about what the last phase of pregnancy is like and what you should be expecting. So we'll be touching on, firstly, what are those symptoms that people feel in the third and in the second and third trimester. And usually, like, people call it the honeymoon stage because this is where after the first trimester, you are beginning to regain your energy and you are enjoying pregnancy more than in the first trimester. But it also comes with its own challenges, as we will discuss very soon. So there are symptoms that you also need to be aware of. There are tips that we'll be sharing on how to best manage those symptoms. And then finally, we'll be talking about the big day, that's the delivery day. So Ikma, I think we can just start with the second trimester. What are the common symptoms of the second trimester?
Yeah, as Belkis said, it's called the honeymoon phase for a reason. Your hormones would have calmed down, especially because your hormones are responsible for the symptoms you had first trimester. Your body is just adapting to the new surge in hormones. So by now your nausea should have subsided, you're energetic, you're able to eat food now, so definitely more food, more energy. And also your bump have started growing. What was once a positive line is now growing into a baby, and you can actually feel and see your body growing. So you can see your tummy growing, and yes, you also start feeling the little kicks, and that is when it actually hits that you're actually carrying a life within you, and it's so enjoyable. I mean, so while a few minority might still have like heightened symptoms, most women actually enjoy this particular stage of pregnancy compared to the other two stages, which are the first trimester and the third trimester.
Yeah, I think you missed out the skin glow. Many people talk about like how your skin will be glowing in the second trimester. Well, for some women, because for some others, as Igma said, it might be a different. For some people, it might be breakouts actually. But I think for majority of women, they experience that skin glow, and you start feeling kicks as well in the second trimester, which is especially for first time mom is usually something to look forward to. First time mom and dad. But even if it's not the first time, every pregnancy is like different. It comes with new experience. So I'm sure you'll be very excited when you see or when you experience that first kick in the second trimester. So I think the second trimester is like it comes with a phase that is more relaxed than the first trimester. But part of what we've always said is your nutrition, your diet is still very critical even in the second trimester. Or what do you think, Ikma? Are there any specific things that people should watch out for with regards to diets in the second trimester?
Yeah. So with diet, it starts from the pre-pregnancy phase, right? If you are not eating healthy before you get pregnant, it's hard to just adopt a new lifestyle overnight. So with the diet plan, it has to be before the pregnancy so that it will be sustainable on the long run. And also, some people start craving different things. Some might be unhealthy for you because some people actually have a condition called pica. So where they start craving paper, sand, chalk, something weird you get, which is not healthy for you, obviously. But generally, even if you didn't have like a diet plan before pregnancy, now you have a life within you and you need to be safe. So don't eat for two because it's a common thing when people say, "Oh, you're carrying a baby now, so your baby makes you hungry, extra hungry." That is a trap. It is setting you up for eating too much.
Yeah.
Exactly. So we plan to even talk about some of the things that, eating too much and during a pregnancy can actually do to you sometimes. So your metabolism has slowed down due to the surge in hormones like estrogen, progesterone in your body. So your metabolism has slowed down. Your digestion process has slowed down. So if you're eating too much, rest assured it's going to just be stored as extra fat, and you don't want that pre or after the pregnancy. So eat your normal portions as you would if you weren't pregnant. Make sure to eat healthy and take the required prenatals that would help you during the course of your pregnancy.
Yeah, those are like very, very important points,
Yeah.
Ikma. And I think other things to also watch out for is making sure that you go for your anatomy scan around 20 weeks. That's like very important. And also like checking out for your doing your gestational diabetes screening. This happens between 24 to 28 weeks. So it's very important that you do this screening, and whatever your health provider is saying, you try and follow it, because gestational diabetes is something very, very critical, and we've seen more and more pregnant women experience this. So it's always easier to manage when it's picked up earlier on. So you don't leave it till late time for your doctors to discover it because you didn't book your appointment or go for your appointments to do your screening. I know it's usually a difficult one for many women because you need to fast for specific hours before you do the screening, but it's just very important to keep yourself safe and to also keep your baby or babies safe as well. So those are like some things to watch out for in the second trimester.
Yeah,
So, if
that
are there any like tip or management that you say people should specifically have in mind in second trimester? Maybe like we've mentioned some of them, the exercise. I don't know if there's anything else that you want to mention.
yeah. So if you were not like a gym person before, or if you are, you still have to like reduce your activities. A walk goes a long way. Taking a walk goes a long way. Like you might see as it's light,
Yeah.
but it goes a long way. Don't just be sedentary. Don't just sit there because you're getting heavier, not just by the weight of the baby. You're packing on weight, which is healthy for pregnancy. But you should get moving and be active so that everything is balanced out. So you need to keep fit during your pregnancy, even if the fatigue has grown, obviously, but you just have to keep on doing something like taking a walk, even if it's once a day, 30 minutes walk or something, just to keep the body active and healthy. And
Mm.
for people that don't know what gestational diabetes is, it is quite common than we think. So often when you start your prenatal appointments, they ask you if you have a family history of diabetes and stuff like that, because while some people might get it because they are susceptible to it through their family members having had it in the past, some people just develop it out of the blue as well. So just because somebody in your family doesn't have diabetes doesn't mean you can't get gestational diabetes. So gestational diabetes sometimes just happens during the pregnancy, and that's all about it. But you have to understand that you are predisposed to getting it later in life if you're not being careful. Don't skip your prenatal appointments. Get checked. You're more insulin resistant during pregnancy just because of your hormones. So I think at this point, your hormones are responsible for a lot of symptoms and ailments that might come up during pregnancy. So do not skip your prenatal appointment. Make sure you're fasting so that they can get for your glucose test so that they can get accurate reading to be able to know if you have something or not, and get it treated hopefully. And yeah, I think that's what I would say regarding gestational diabetes and also keeping fit.
Yeah, very, very critical because everything you said now, it just ties back to also part of what we wanted to mention in this episode about advocating for yourself. It also starts with taking those little steps that you need to take in order to put your health first and also to ensure the safety of your baby. Like we've mentioned about diet, we've mentioned about taking all your screenings and tests very seriously and everything. Another tip that we can share for the second trimester is about pregnancy pillows. I've seen videos of women talk about how helpful the pregnancy pillow is, and you can start using it from your second trimester or even the first trimester, depending on what kind of comfort you are looking for. There are very comfortable ones that you can get online, and it really helps because in the second trimester, your bump is growing bigger, so you might be looking for support, looking for the best sleeping position. The idea is always to sleep on your right side. You shouldn't sleep on your stomach. So just watch out for the sleeping positions that your doctors recommend for you. And also try to get a leg pillow or a pregnancy pillow just to help you have better sleep during your second trimester because people also experience headaches sometimes in second trimester, mood swings. All of these things are normal, but you can also manage it if you try to get better sleep by trying to get comfort through things like pregnancy pillow. If you know any other app as well, we'll be happy to hear comments, views in our social media platforms. But that's part of what we wanted to share for second trimester. So Ikma, is there anything else before we go to the third trimester?
Oh no, I don't think I have anything to say. You've said everything there is practically. So, and as you said, if anyone else has a hack for this, you can also share with us. And yes, yeah, I think we can move on to
Okay.
the top.
All right. Nice. Ikma, do you want to start with the symptoms that people experience in third trimester? We've mentioned about the second trimester. So, are there any changes in third trimester that people should be aware of?
Yes, yeah. So for the third trimester, the baby is constantly growing every day. So in the third trimester, that would be from 27 weeks upwards. And your baby is at the size of maybe watermelon or even smaller, depending on your baby's weight. So you're obviously bigger at this point. Your symptoms are heightened, symptoms like acid reflux, not just from slow metabolism, but because your stomach has been compressed by the increase in size of the baby. So you might really, really experience serious acid reflux in this stage, which might in turn meddle with your sleep. For some reason, it just that acid reflux, happen mostly at night when you're trying to sleep. So I guess it's because of the position we put ourselves to sleep, and that is where your pregnancy pillow comes in, because you actually have to prop up yourself, as Balkis has mentioned earlier. The pregnancy pillow is actually so useful. So in propping up yourself, because it can be quite uncomfortable to lay flat on your bed, the acid would want to come out and all that stuff. You don't want that. So you always try to prop yourself up. And if symptoms are still persistent, you know what we say to that. You reach out to your medical expert and have like a prescription so you can feel better. And hopefully when you have your baby, the symptoms would all vanish. Yeah. And another one could be swelling, which sometimes might be normal from water retention in your system. And it could be also a symptom or a warning sign of preeclampsia. Now, preeclampsia, guys, is a very, very important and a very, very dangerous thing to have. So you need to be like very vigilant. You know your body and you can easily tell like different changes. So swelling like things like with your hands and your feet and your ankles and stuff like that, you need to get it checked, because preeclampsia, like other than the swelling, you can have like high blood pressure, you can start like having blurry vision and persistent headaches. So if you're in your third trimester and you're having persistent headaches, you're having excess swelling from water retention and all that, you need to have it checked just to make sure it's not preeclampsia. Because if it goes from preeclampsia to eclampsia, that is when it is harder to curtail, because instead of like, normally the doctors would prescribe maybe cesarean section to get the baby out so you don't go into labor, because when you go into labor, your blood pressure increases. So they don't want that. So usually they will want to safely bring out the baby through cesarean section. And that is fine. Yeah. So if you have those symptoms, get it checked before you actually get into, because it is harder to revive when it gets to the eclampsia stage, because you'll be convulsing, you go into coma and all that stuff, and you don't want all of that. So be vigilant, and any symptom you notice, call your doctors and complain.
Yeah, very helpful. Did you mention the frequent urination as well?
Yeah, so while it's like pushing up, while the baby is pushing up your stomach, it is also pushing on your bladder. So that's another thing. You could go, because there's pressure on your bladder, you always have to go to the toilets every now and then. Yeah, especially at night too. So sleep deprivation starts even during the pregnancy. So it could be really, really bad sometimes. Unfortunately, there's no cure for that other than reducing your liquid intake. But then you need the liquid to stay healthy and hydrated, so you can't reduce that. So you just have to wait it out, and hopefully you get better. So yeah, and another thing I would like to also mention is that Black women and Asian women are more susceptible to getting gestational diabetes and preeclampsia, as we've earlier mentioned. So if you're a Black woman or an Asian woman, you should be more aware of your body than anyone else, because this is already a fact that is known, and the statistics are not joking, and there's a high increase. So we need to be aware. Childbirth is such it's a blessing, obviously, but sometimes it could be dangerous if not handled carefully. So it could be the reason why your life actually comes to an end. So having that at the back of your mind should actually not make you naive about the situation you're in when you get pregnant. You know that you have to start advocating for yourself, check out every symptoms and be reporting it, because a lot can come out and we have no idea what it is, and until it's too late. So yeah, advocate for yourself.
Very important, very important. And also tying back to your point about the frequent urination, I think women should also be aware that urinary tract infection could also happen in the third trimester or even the second trimester, because if you are visiting the toilet like very regularly, because it's normal, you're taking more water, as Ikma mentioned, the pressure on your bladder as well, you'll be visiting the toilets more often, and this exposes you to the risk of urinary tract infection as well. So if you are experiencing any symptom at all around this, either itching or you're seeing like a cottage cheese kind of discharge, you need to speak with your doctor like as soon as possible, or your midwife, about it, just so that they can think of a safe way in order to treat that infection as soon as possible, if indeed it is UTI, because it could also be anything else. It could be thrush, it could be UTI. Just get it checked if you are feeling anything around that. Okay, so I think we can talk about things to watch out for as well in the third trimester. Ikma has mentioned something about swelling and also preeclampsia. We just need to ensure that we are regularly getting ourselves checked and making sure that you take your prenatals till the end, or till when your doctors are advising you or saying that you can stop using it. I think also like one critical thing to watch out for would also be contractions. You could have painful contractions in the third trimester, and this is your body just preparing itself for the big day. And it could also be that you're already in labor. So it's important that you are prepared that it could happen anytime. Or what's your view on that, Ikma?
Yeah, a lot of people actually go into labor earlier than planned. I mean, the average is usually like 38 weeks, and that's when you're like considered full term. But for some people, unfortunately, the baby starts coming earlier because the body just goes into labor mode, and there's nothing. Some people, while they're able to like stop it from maybe just getting a few treatments from the hospital, or even something as small as getting bed rest if it was induced by stress, some people unfortunately can't be held back, and they need to deliver the baby. So the important thing
Mm.
is when you notice maybe your water bursts, or you're having like an unrecognized or unfamiliar kind of discharge. Sometimes it can be UTI, as Balkis has mentioned earlier, but other times it could be warning sign of labor, because when that mucus plug is out, then your body is ready to start pushing or start bringing forth the baby. So this is why we say you can't keep quiet at any time. The babies can come earlier. While the hospitals are quite equipped with things, especially if it's like after 24 weeks, because 24 weeks is actually the time that the hospital says that it's viability week. So viability week means the stage at which your child can actually survive outside the womb if they were born. So if after 24 weeks you go into labor, the child has like a 70 to 80% chance of survival, or before that, unfortunately, percentage is way less. That's it about like um having a preemie baby. So while it might be a tough situation, sometimes the hospital are able to handle it effectively and protect your child from, because they're susceptible to getting like different infections. They came out earlier than expected, so they are very, very fragile. But definitely, the hospital should be able to do one or two things to keep them in check.
Hmm. Yeah, and also like it's very important that if you notice any slow movements of your baby,
Yeah.
should like imagine it's an emergency. You need to go to the hospital like as soon as possible. I've seen a video circulate recently where a woman shared her story, and she stopped feeling the movement of her baby in the third trimester. I can't
Hmm.
remember what week specifically, and that mother instinct just made her go to the hospital immediately. And yeah, lo and behold, like she had to do an emergency C-section. Unfortunately, the baby did not survive.
Yeah.
But it's good that she still made efforts to go to
To
the
try.
hospital like as soon as
Yeah.
possible. Immediately, she noticed that movement slowing down. So it's very important that you watch out for that as well in third trimester. So what are the other tips that we can share for third trimester? I think Ikma mentioned about swelling. So the pillow thing that we said is still very much valid in the third trimester. You're also talking about, making sure that you are buying things that you can, because you need to start preparing your bag for delivery. Or Ikma, what week specifically would you say that women should start, packing
I mean,
things together for like their hospital bag for delivery? I think that happens in the third trimester, right?
yeah, usually, but I think from viability week, because while we're not praying for like the child to come earlier, you actually need to be prepared just in case. So you start getting your hospital bags ready, you know the essentials and all that, like maybe at 20 weeks, because then at 20 weeks you do your anatomy scan and they're sure the baby is healthy or something. So yeah, it's quite advisable to. I mean, some people start getting it from day one. It's quite cute and interesting when you want to get those things and all that. Yeah, particularly after 20 weeks, you should start getting ready because baby could come anytime. For also people carrying multiples, that could be an extra strain on your body. One child is already strenuous enough, more or less multiple pregnancy. So in fact, the doctors would usually consider multiple pregnancy as a high risk pregnancy. Extra care would be given, more appointments, more prenatals, more everything. So if you're carrying a multiple pregnancy, it means you need to be on the lookout even more, because
Mm.
the babies are sharing everything and there might not be enough resources to go around, so which puts you on the edge of being a high risk patient. So you need to be on the lookout. Don't be naive, don't be afraid to ask questions, don't be afraid to communicate your symptoms. Don't feel like you're a burden. I mean, you're paying for the medical care that you're receiving, so you shouldn't feel like that and end up in a miserable position.
Yeah, yeah. And very valid point. Also, like very important for you not to forget your emotional prep as well, because with delivery, it comes with a lot of anxiety, which is very
Yeah.
normal. So remember to do your meditation if this is something that appeals to you, and also like your usual spiritual routine, if this is something you do as well, because you need a lot of that as you go into delivery. So Ikma, let's go to the last phase of our episode, which is about the D-Day,
Yeah.
delivery day. So what are those things to expect?
While in our society, I don't know for others, it's not something that is mostly spoken about, especially because, of course, it's from a good place of not wanting to scare young women about the delivery processes and all, because it can be a bit horrific or gruesome experience for most. So, yeah, a lot of people don't like to discuss it, but you know us on this podcast about sharing awareness because we want you to be as informed as possible. So, for delivery, we can't really promise you that it's going to be painless. While there are painless methods, though, not really, you have to get to a certain level. Let's take, for example, some people, oh, before we even dive into that, first of all, I would like to say it's very important to have a birth plan. While the birth itself might be unforeseen, or let's say while it might not go according to the plan sometimes, or even most times, it's always very, very good to have a birth plan and also have a birthing partner, right? So because when you're in pain, you can't advocate for yourself and you can't notice something's going on around you. So it's very important to have a birth partner as with your birth plan as well. So in your birth plan, you are allowed to choose the method you want to have your baby. So you can have your baby naturally without medication or anything. Some hospitals offer like medications like epidural and all that stuff to help take the pain away during the delivery process. And some people opt for elective cesarean section. Sometimes the cesarean section can also be done in a phase of emergency, like when something goes wrong, it can be performed. So we just want you to know that whichever way you choose to have your baby, as long as you and your baby are healthy, that is the most important thing. Because we see tweets every now and then about people shaming, especially women. You would think that they know better, but a lot of women shaming other women for the methods they have their baby. Oh, you went to C-section, it wasn't as painful as a natural delivery. Or you had the epidural, so you must have not been in pain for long. So as if there's a reward for going through so much pain. If there's anything that makes your life easier, please, as long as it's safe for you, please take the option and focus on the afterbirth because there's still a long way to go. And while you're able to save yourself some stress, please do. And yeah, that's what I would like to say about the delivery options available for women.
No, that's very helpful. And honestly, well, it's so disheartening that in this age and time, you still have people shaming particular delivery methods. It just doesn't make sense, really. Because irrespective, you see people say, oh, it's CS. What
Mm-hmm.
does that mean? Like, CS is not even easy at all, as
No.
well. When you hear people's experiences and things they've had to go through, pre-CS and post-CS, honestly, you even be wondering that is vaginal delivery not even easier. So you definitely should not be shaming any kind of delivery method. Either people choose to use epidural or they don't. Whichever way is fine. Do what's works for you and let other people do what works for them as well. As long as you are safe and your baby is safe, as Ikma said, at the end of the day, that's what is important. There's no debate about which one is good and which one is not. And honestly, I think what you said, Igma, about having a birth plan is very important. And usually, when we see in movies that people are ready to go into labor, like the water just breaks, maybe you are somewhere and they rush you to the hospital, and immediately you're already in the delivery room and you're screaming and the baby comes out. I think in reality, it doesn't happen like that for everyone.
Yeah.
And
But
in fact, it doesn't happen like that because you the doctors might put you in a particular room or first and then waiting for you to dilate to the centimeter that they want you to, and you could also be having different kind of pains, going through different things at that stage. It doesn't come as easy as it seems in movies. That's part of what I'm trying to drive at. It comes with its own challenges, so you should be prepared for that already from the beginning. And also making sure that you have someone with you is very important just to keep you calm. And one thing I've heard women talk about is also like what they experience during labor, like pooing. I don't know, Ikma, is this something you've heard of as well? But I know that nurses are
Mhm.
equipped to be ready to experience that kind of mess. So you shouldn't really like feel embarrassed about it. Or what do you
Yeah.
think about that, Ikma? This is something that I've heard women raise concerns about that. They might not be able to hold their poo during labor and it just comes out and everywhere is messed up. But I don't think you'd be worried about that anyways when you
Uh,
are in that moment.
and you don't need to be worried because the medical staffs, the nurses, and the midwives are equipped for that. It is part of their training because you can't actually judge the person giving birth because you're asking her to push. And it is the same muscles, almost the same muscles, not exactly required to push a baby out. So definitely, if you have some residues in there, it's going to come out. So most nurses that I have seen have actually handled it pretty well. In fact, you won't even see the poop when you get up because it's part of the thing. They tell you to feel comfortable. They actually assure you that it's okay, don't be embarrassed because while you're trying to hold the poop back, you're walking against them because they're telling you to push. And if you're afraid of pulling, then you're not pushing, so it's not going to work like that. So they're medically equipped for that and are ready to catch anything, when you do that. So feel free to poop as much as you like. As long as baby comes out, you're fine.
Yeah, yeah, I totally agree. Okay, so let's also talk about post delivery. So,
Okay.
I know people experience like pain, contractions as well, even post delivery, and it's just your uterus, you know,
Mm.
going back into its normal shape. It's not something you should be worried about, but if it's very severe, can definitely seek medical help as well. So, what are those myths and realities that we should discuss about? There are so many myths out there. You hear people
Yeah.
say, "Oh, you shouldn't work out during pregnancy at all," and this is just covering everything pregnancy. You say, "Ah, you shouldn't work out at all." They are just very scared that anything might happen. I think that's not true. You can work out as long as it is safe,
Mm.
minimal kind of exercise because you need to move your body as well as we've said. And if you are in any doubt at all, you should always ask your doctor, your midwife, just seek medical advice if you are not very sure of your status, if you can't do exercise or you cannot do exercise. But people would generally advise that you do minimal kind of exercise like walking during pregnancy. So that's a myth that you cannot do exercise at all. What other myth have you heard of, Igma, that you like to share?
Yeah, it's actually funny, right? When they say when you're having extreme heartburn, remember we mentioned about acid reflux. So when you're having heartburn, your baby is hairy. And it's actually really funny
Wow,
because
that one is very hilarious.
some people have children and the children are bowed and almost bowed, sorry to say, but they had like a lot of heartburn. So your heartburn is not from your baby being hairy. It's just from the slow the slow
Yeah.
metabolism and also the baby taking up space. So definitely you would have acid reflux and it's not a result of your
Mm.
hairy baby. And another thing I've heard about pregnancy is to, you know, if you eat a lot of okra, your baby will come out and be salivating a lot, which is not true. Also, which other one again? If you're going to, you have, if you're still beautiful at the trimester, your baby is a boy, and if you get ugly in the third trimester, or you have like some body dysmorphia or whatever, your child is a girl because the girl like to take all the beauty, and the boys don't like taking the
Okay,
beauty of
that
them.
one is an interesting one.
It's so hilarious when I hear these things, but it's
Yeah,
all
people
down to
also say that spicy food will induce labor. This one is a myth because if spicy food will induce labor, then I mean, it's no one should eat spice at all. But we've seen people eat normal Nigerian food, and it's
yeah,
not as if they're going to premature labor or something. So that one
yeah,
is a myth as well. And people also say when you have like big bump, it means your baby
yeah.
will be big. That's a
Mm.
big myth
Ah,
because it necessarily doesn't mean that you will have a big baby as well when you have a big bump. Is there any other one you want to share? I think we've shared the most common ones.
yeah. So whatever meet you hear from anywhere, like if anybody that is not a qualified medical personnel is telling you about anything that concerns your body, please ask your doctor about it that way. Is this true? Because sometimes it's not enough for somebody that is not qualified to just come and tell you something or give you something to drink or give you something to eat. You need to even verify if that is particularly even safe for you to consume. So always be on the watch for people that might try to force things on you. Always ask questions before you consume anything in the course of your pregnancy.
Yeah, yeah, no, I totally agree. So those are some interesting myths. If you are listening to the episode, if anyone comes to mind, feel free to engage with our episode on wherever you're streaming your podcast, or you can also go to our social media platforms. We'll always love to hear from you as well. So let's talk about the checklist for women when you are
Yeah.
going into yeah, delivery. So what would usually be in hospital bag? 5 things perhaps
Yeah.
that
So
you say
I
you
think
have to have in your hospital bag.
yeah, I think mostly for women it has to be like two separate bags depending on how you pack, but it's for you and the baby. So you have to look just like you would pack for a day or two trip, but sometimes it can be more than a day or two considering that we don't know what to expect sometimes. So for the baby you can take, because most hospitals offer diaper or whatever for a start, but of course you need spares from your own, baby's clothing as well, your own clothing, your own footwear to move around, and a charger, your skincare, baby skincare. Sometimes the hospital doesn't allow you to bake the baby. So depending on what the hospital wants, because sometimes they actually give you a list of what is necessary. So you can decide to add what you might need for your own personal use. But for hospital use, they would normally give you a list and of what to get. So yeah, I think you should stick to the list sometimes and just add a bit extra so to avoid overpacking. But for first time moms, they mostly overpack, and that's okay. If you don't get to use the things, you can bring them back.
Yeah, yeah. I think also if the hospital is not very close to you,
Yeah.
also remembering the car seat is
Yeah.
critical, so that you, whether you are ordering Uber or however you choose to go home, you can
Yeah.
have a car seat to use.
Hmm.
Most people forget that, but it's also
Yeah.
important to have that in
Yeah.
mind. And
And even
also go with your support system. Yeah,
yeah,
go with
hospital
your support
lets you
system.
out. Yeah.
What did you say?
I said the hospital won't let you out if you don't have a car seat, like because you
Mm,
are transporting the baby home, so they need you to have a car seat before you even leave the promise. So
yeah.
you'll be
Yeah,
in the list.
yeah. Okay. So, yeah, I was saying your support system
Support.
as well is important. So, if you have someone around you that can help, that can be there for you, your spouse, yeah, so that's also very critical. And be nice to them because emotions are high. At that point, it's not easy for even our men, to be
Yeah.
honest. It's a lot. I watched a video recently where you know, the man was talking about the emotions that men also go through during this phase, during delivery. Like everyone is sending you here and there, you are going here, going to get, and
Yeah.
nobody is really asking, how are you doing? So our men's health, his mental health is also very, very important because the stress level at that point is, and the emotions are very high for them as well. So try and be nice and gentle. The hormones will drive certain things, but always remember that there's someone that is also at the receiving end, right? So you try
Exactly.
to manage as much as possible. Okay,
Yeah.
so I think that's it really. Ikma, is there anything else, final words that you want to share?
Yeah, you spoke about, choosing a bed partner, and I think that's a very, very important part. Sometimes some hospitals allow two to three, or sometimes, but wherever you are taking with you, make sure the person is well informed about your needs, and because sometimes people go there and just make a video of you, make fun of you. It's very, very important to be in a good mental state. Choose somebody that is well informed about what you're about to put yourself through so that they can encourage you. It's not just to stand there and, bring things. It is also emotional support. If you have somebody mocking you in the background or telling you degrading things about yourself, oh, stop shouting, you're shouting too loudly, something like that, it's not helping in that moment. So if you want to pick somebody to help you in the hospital, make sure you're picking the right person. Also, let them also be in the lookout. We've had of cases where there are people that have said they exchanged their babies during the delivery process. And that's why it's very important to have a birthing partner. It is so scary that we've heard cases about like somebody when they have a baby, they exchange their baby for somebody else, things like that. So while you're giving birth, sometimes you don't even have strength to be aware of your environment or what is happening. And some people actually even go through dissociation during the childbirth. Like in that moment, your body is in shock. You don't even want to see the baby. You don't want to hold the baby. So in that small moment, like a lot of things can happen because you're not the only one giving birth at that particular time. While some hospitals have some strict rules of not taking the baby outside the room, your baby might need some certain help or something like that, resuscitation that might require them to go outside the room. So always have somebody that's standing on guard, like, while you might not be aware of what is going on, ask them to check, ask them to follow up, always be on guard about, this kind of things. Because in the society we live today, there's a lot of evil and you can never know like somebody's intention just by looking at them or trust them fully just because they're a medical staff. So you need to have somebody, a trusted person that would help you be on the lookout while you're giving birth and through the entire process. So that's what I would like to say to that.
Yeah, no, very, very valid points. I think my own final words would be that this whole pregnancy journey is very unique
Yeah.
to everyone and it's very different. Each pregnancy is not the same thing. Remember to advocate for yourself. Remember to put yourself first as well and always think about the safety of your babies. So do what you think is right for you. As Ikma said, people can make mistakes, even medical professionals. So, but just follow your instincts and ask questions. Whatever you think you're unsure of, have a trusted person as well with you that can walk this journey with you. So, if you really enjoyed this particular episode or any of our other episodes, don't forget to share it with any woman in your life that you think might also find it very relevant. And we always love engagement from all our audience, so you can always engage with our content on our social media platforms and also on wherever you are streaming your podcast from. So thank you so much for staying tuned and we'll see you in the next episode.
Information shared on this podcast are not to be considered medical advice. Always consult with a qualified medical professional for all your health concerns. Thank you.